COVID Germs. We are in this together. Rapid testing, PCR testing, antibody testing. At COVID Germs, we are the solution for rejoining communities. We believe freedom and safety should not be at odds. Introducing Dr. Alexander Evans.
Hi, I'm Dr. Alexander Evans. What I'd like to talk to you about today is COVID-19 testing. But first, let me give you a little bit background of about myself. I graduated from the University of Florida and did my training in general surgery at the University of Illinois at Chicago. I then spent about 6 years in the military with the U.S. Navy, where unfortunately I had to experience Afghanistan and our war in the Middle East. But God willing, I was blessed to be part of that effort and helped to save a lot of people. But after that, I went to Johns Hopkins, and there I attended and became a critical care physician. In doing so, I finally became the medical director at Central Florida Regional Hospital, which is in Sanford, Florida. I've been there for about 5 years now. Now, during the last year, I had the honor and opportunity, along with a group of individuals there at the hospital, to direct the COVID-19 response. I was on a committee that helped to guide that care. But also in the community, I coordinated with the community and with local health groups, statewide or local-wide testing, so county-wide testing for COVID-19. I also worked with the health department to decrease inoculation of local communities. So my understanding and familiarity with COVID-19 grows and grows. It has been extensive. I want to talk to you a little bit about this testing. We are a medical supply and support company that allows us to give and support industries along with hospitals.
For these very reasons, we recognize that testing at scale is the key missing piece.
Now, there are few tests out there, but we supply the rapid test along with the PCR test and antibody testing. Let's talk first about the rapid test. The rapid test is just that, it's rapid. It's still the same nasal mucosal testing that everyone does, but it comes back in about 15 minutes. Many companies have it, and the thing about it, it's an immediate test, so it's great for industry, it's great for getting people back to work, it's great for places like entertainment, facilities, factories, nursing homes, and sports, and even hospitals. So it's a rapid test. The only issue and difference between the PCR and the other is this one, the correctness or the sensitivity is what we call it, and specificity is within around, I should say, 85 to 90%. So that's where it's a little different. However, there is the next step above, which is the PCR test, which is the one that came out first, more of a specific test looking at the molecules of that. And that one is a little bit more sensitive and specific. It's closer to 98, 99%. Now, the reason why you jump to that is because if someone has very ill and you're not concerned, you're not completely convinced, then you move to that. Usually that's done in the hospital setting, but also any sort of industry that you feel that you want to make sure these people are in close contact and this person comes in ill or not feeling well. Yes, you want to go ahead and do that and keep them away for 48 hours, 24 to 48 hours until the test comes back. That's the issue. It's not rapid, so that person can't just go back to work or go back to their duties or the ball game. Now, after that, we have a couple things called antibody tests. Antibodies are the things that the body makes in response to any type of infection. So it makes these things, attaches to these bacteria, or attaches to anything that has the virus within it, and tries to kill or get rid of that. There are two types of main antibodies, the IgM and the IgA. The IgG, forgive me. There is IgA also, but IgG. The IgM is what comes out first. So if someone is positive for IgM, they likely have had the virus between 2 to 5 days. That person should probably, number one, get an antigen test, and number two, stay home for about 2 weeks until we make sure that they're negative. The IgG is what comes out anywhere from a week, usually, but more about a month. You really see the response, and it can last much, much longer. That's the one that's kind of memory in your cells. That person is immune to it, whether it be temporarily or strongly, but they definitely have seen COVID-19 in their body, and they've responded, and now they have a response to it. So if they ever get involved with it again, either it'll be very mild or not, they won't even see symptoms. So that person should get the antigen test. However, at that point, they don't necessarily need to be quarantined. Just make sure that they don't currently have it, and they can continue going on with work. I hope that helped. I just want to make sure that you know that we're here for you, and thank you so much.
COVID X Germs offers the COVID-19 antigen test, which is a rapid POC test with results within 15 minutes with 85 to 96.3% accuracy. Also offers the COVID-19 RT-PCR test, which is the saliva test. It's a non-invasive viral detection test with results in as little as 24 hours after receipt in the laboratory. This test has a 98 to 99% accuracy. We also offer the COVID-19 antibody serology test. This is a blood test that's done to find out if you've had a past infection with the SARS-CoV-2, which is the virus that causes COVID-19. An antibody test can't determine whether you're currently infected with the COVID-19 virus. We are proud to have partnered with Priority Laboratories, which is a community-driven lab. Priority Labs uses the most sophisticated and precise equipment and technology available. The laboratory is divided into 2 departments, infectious disease and toxicology. Both programs utilize the most advanced methodologies currently on the market. COVID X Germs has proven success. We bring decades of experience as executives, entrepreneurs, medical specialists, technologists, investors, and government officials. Our diverse team comes from many backgrounds, and we are partnering with some of the world's largest and most prestigious companies such as Amazon, Samsung, Cisco, McKinney, U.S. military branches, NASA, HP, SGI, and Ameritech. We use our experience and education to help solve some of the most pressing medical challenges facing our world today, and we look forward to serving the community during this global pandemic. COVID X Germs thanks you. Remember, we are in this together.